Welcome to the Inspire and Ignite series with Safe States Alliance. Each month, we bring you a two-part series on a different topic. This month focuses on using National Violent Death Reporting System data to support veteran suicide prevention. You're watching part one, our pre-recorded webinar with subject matter expert Lindsay Emer. After you've watched the video, make sure to submit your feedback and any questions that you're interested in exploring more. On August 28th, we'll be hosting part two, our group discussion about using NVDRS data in your work. This will be an informal conversation with other injury and violence prevention professionals. You can register by using the QR code at the end of the recording. Hope to see you there.
Hello everyone, my name is Lindsay Emer and I work at the Wisconsin Department of Health Services. I oversee the Wisconsin Violent Death Reporting System and the state unintentional drug overdose reporting system for our state. And today I'm going to talk a little bit about how we use Wisconsin Violent Death Reporting System data to support veteran suicide prevention efforts in our state. First, I'll report that I have no conflicts of interest. This work is made possible by funding from the CDC's Center for Injury and Violence Prevention. As many of you are very aware of, continued federal funding remains uncertain for this program and many other programs. Something just important to note as well is that Wisconsin doesn't have any state funding for injury and violence prevention, so we rely completely on this federal funding. Here's an outline of what we'll discuss today. First, I'll just give a brief overview of NVDRS for those who are not as familiar. Then I'm going to talk a bit about how I had to really build a strong foundation before I could even think about dissemination. So I'll talk about kind of the different things that I had to do to build that foundation. And then I will discuss the actual data projects that we had, the dissemination projects that we had to support veteran suicide. And then I'll touch too on what's next. What are we working on beyond veteran suicide? So real briefly, NVDRS, or the National Violent Death Reporting System, and again, our arm of it in Wisconsin is the Wisconsin Violent Death Reporting System. It's one and the same, it's just mine focuses on Wisconsin violent deaths. So when they say violent death, what is that? Here are the different violent deaths that we collect information on. So every suicide, every homicide, every legal intervention death, which is one where an officer is involved. An unintentional firearm is, for example, when two kids are playing with a gun and it accidentally goes off, so it was just kind of an accident. Undetermined intent, but violent in nature, so it's sometimes difficult to really drill down and figure out the intent of a death, whether it's a suicide, for example, or not, or an accident. But it was violent in nature, so it's still included in the data. And then finally, terrorism-related deaths. So this is one of the main things that makes NVDRS unique. So we get data from 3 different data sources and combine them. So a death certificate, a coroner or medical examiner report, and a law enforcement report, all on the list of deaths that I mentioned in the previous slide. So it's a very comprehensive look at each incident. So you get a lot of data as well. So if we were going to zoom in a little bit more on Wisconsin, specifically the Wisconsin Violent Death Reporting System. So this is our map of Wisconsin. We have 72 counties, and so within those 72 counties, we have 68 coroners and medical examiners. 6 of them are forensic pathologists, so they can do autopsies. And then we have 600 law enforcement agencies. The biggest thing about Wisconsin is that we are a decentralized home rule state. So that means that counties can kind of just decide how they want to do things. So they get to choose if they want to have a coroner or medical examiner. They get to choose which type of case management system they want to use, and another county can pick an entirely different one, and then yet another county could just use paper records. So how this affects us is that we have to request all of these records separately. So it's very time consuming because we have to reach out to every single coroner, medical examiner, and every single law enforcement agency. And some only accept faxes, and some they gave us a login and we can go into their system, and some will mail us thing. So there's a lot of coordination and logistics with acquisition. So the requesting and the acquiring of the records that we need then to enter the data. So before I talk about our dissemination products, I just wanted to stress a few things about how important it was for me to build a solid foundation before I could even consider dissemination. So I'll talk about our team and how I needed to get to know our partners and also get to know our data. When I started 4 years ago, the only staff we had was Jean at the top. She was a part-time abstractor and she had no other staff. We had just a lot of recent turnover. And so as I talked about before, there was no way that Jean as a part-time abstractor was going to be able to get all of the cases, request them all, acquire them all, and then enter them. So she needed a lot of help quickly. So I first was like, what can I do to help you as soon as possible? And took over all the acquisition. And then we were like, we need to find some solid staff that can hit the ground running to be these other two part-time abstractors. And Jean is a retired law enforcement, and she had said that there are a lot of law enforcement that kind of retire on the earlier side and are still looking to do things to contribute, but nothing nearly as intense as law enforcement again, and they need flexibility. So she said this is kind of like the perfect job for somebody who is recently retired law enforcement. So we decided to post on police union websites. They have job listings. And we ended up getting two wonderful people. Chuck is he's a retired homicide detective. And Shelly used to work in the homicide records department. So both of them had this vast knowledge of police reports and police investigations, and which is something I can't teach them because I don't have any background in that. I can teach them public health. So it was this perfect training mix of they brought all of that experience from law enforcement, but then I brought in all of the public health and kind of like the public health lens of things. So they are a solid team and they have been there ever since. We haven't had any turnover and it's been wonderful and critical to, again, later being able to disseminate the data. And I would be remiss if I didn't mention our 3 SUDORS abstractors as well, which is the state unintentional drug overdose reporting system. That Kim, she does all of the acquisition now. So now I don't have to do the acquisition, and that frees up my time for dissemination. And 2 other abstractors, Jane and Jennifer, who also assist with suicides when, again, the workflow is kind of ebbing and flowing and they have some time available to assist NVDRS. So again, without this really strong team, I wouldn't have comprehensive, accurate, reliable data, which is number 1. And number 2, I would have no time to be able to do any dissemination because I would need to be in the weeds with them. So this was kind of the first step in the building my foundation in order to be able to disseminate. So after hiring a really strong team, thank goodness, I also need to actually get the data. So I've got this team ready and willing to abstract, but like I said, we have to request it from everyone and they have to send it to us. So the first thing I did when I started was I called every coroner, medical examiner. I emailed them as well, so they had both. And, I wanted them to know that there was a face on the other end of these requests, that we were actually doing something with the data, and it was important. And I could answer any questions they had about how we were handling the data, what we were going to do with it. We also started holding technical advisory board meetings, so any coroner medical examiner was invited. We talk a little bit about what we're doing, and then we'd ask them to talk about a little bit like what they're doing. That's when we found out Marathon County was building this big new forensic science center, regional forensic science center, which was going to help provide autopsies throughout the northern counties. Then really listening and learning and remembering what they say when we're having these discussions, because those are things that I can bank when I do finally have time to do some dissemination and think about like what might be meaningful dissemination based on what some of the needs that they've expressed in those conversations. And then finally, I didn't want this just to be like a one-way relationship. I wanted to be able to provide support when I could as well. And so just small things that they would mention, I made sure to do them. I followed through. So for example, this map is one of those things. Their Wisconsin Coroners and Medical Examiners Association needed an updated map, and we got this for them. It's just a good resource to have in general, but it's something easy that I could do to support what they do. So it's all of this is a lot about just building relationships so that you're building this trust. And as I was building that trust with them, more and more coroners and medical examiners were willing to share their data with us. So again, it's just building the comprehensiveness and accuracy of our data at the same time. And finally, getting to know your data. So when I got this job, I had worked in violence prevention, but predominantly in Milwaukee County, not statewide. And so I was more familiar with like violence being homicides. But when I went statewide, it's predominantly suicides in Wisconsin. So I really dig it when I get the new clean data set each summer. I really dig in and I really look through it to see like what's popping up, what populations all of a sudden are, it's becoming more concerning, their rate is going up, or which ones are disproportionately affected. And so when I know that and I have that in the back of my head, then I'm primed and ready to, act when potential dissemination opportunities come about. Because I'm like, oh, I know we have like veterans are disproportionately affected in Wisconsin, and then this opportunity came up, and then it's like, well, I know that we can provide data that can support this, and that's a population that needs attention. And I'll just show you. So one of the things that we did initially was we included this in a different dashboard that someone was working on and on suicide. And I brought up the point like, veterans are really disproportionately affected in Wisconsin. Maybe we should highlight that at the bottom to make sure like people know that. And so this is again from knowing the data, I could bring it up while we're having this discussion on suicides, and we could then highlight why this population has some unique qualities as well compared to non-veterans who die by suicide. So I knew all of this going in, and then when these opportunities presented themselves, I knew we could be supportive. So because I was primed and knew that our team was solid, our data was solid, and that veterans were disproportionately affected by suicide in Wisconsin, when these opportunities came up, I was ready to say, yep, sign us on, because these are things now we know we can support. So I'll go through each of these separately. So first off, a little over a year ago, we were contacted by the Wisconsin Department of Veteran Affairs, and they brought to our attention a grant that was going to be available to start a veteran suicide mortality review team. And they wondered if we would want to be a partner. And because I knew our data and that veterans were disproportionately affected and that our data was solid, I knew we could support this effort. So we signed on. So we have been assisting the Veteran Suicide Mortality Review Team in two different phases. The first phase was doing veteran status validation. So we get our veteran status from the death certificate. And the death certificate, outside of the cause of death, which is done by the coroner or medical examiner, is predominantly filled out by the funeral home director with the next of kin. And it's not validated through the VA if they say yes, they're a veteran. So we wanted to make sure that the data was valid and to make sure that we were going to be actually reviewing veteran cases. So we compared our death certificate data with Department of Veteran Affairs data, and it was very close. So we were happy to find out that that is a pretty reliable way of doing things right now. So that was good for us and good for them. So then we had the validated list of veterans who died by suicide, and then now we've been supporting them through just like showing data, learning from the data, So for example, we did a fact sheet to kind of orient members of the review team on what veteran suicide looks like in Wisconsin. And that's also being used to inform case selection. With case selection, you usually want to find a case that kind of represents potentially like a lot of different cases versus just a unique case. So then the prevention recommendations can be broadly applied. And then also we're still working out kind of what it's going to look like during the case review and what it makes sense sharing with Wisconsin Violent Death Reporting System data as well. So here is an example. This is the fact sheet that we made. This is the top of the fact sheet. So we were looking at only 2022 veteran suicides at the time. So it just gives a general idea of the number of veterans, the rate, just the overall population versus those who died by suicide. They were mostly male, older than 55, and typically used a firearm, specifically a handgun. And then, so here is the other half of the fact sheet. So this is also really showcasing the unique elements of the VDRS data. You don't get this type of comprehensive data in other data sets, especially the life experiences. For example, 50% having a physical health problem prior to dying by suicide, a quarter had intimate partner problem, and a third had alcohol and or drug use concern. And so not only can this fact sheet give a just like baseline understanding of veteran suicide in Wisconsin, it can help choose which cases then they're going to review. So if almost half of all the veteran suicides at least had a physical health issue, maybe we want to look at people who had physical health issues before they died by suicide. So it's helping just kind of inform and also think about case selection and case review. So while the veteran suicide mortality review team is developing and being trained, and we're talking about data needs, at the same time, I had gotten a Joyce Foundation grant to build a Wisconsin Violent Death Reporting System data dashboard. We did not have one. And so I'm having these conversations with those who are in veteran suicide prevention while I'm developing this. And it came up that they have a lot of data needs that they can't meet because they just don't know where to go. There isn't the data available online, or they don't know who to ask. So knowing that our veteran status data was strong and validated, we decided to include it in our dashboard as almost like a demographic variable. And so this is just an example showing a screenshot of one of the dashboards. But like up here, you can see, incident year, manner, sex, race. Veteran status is one of the filters they can choose, and that would change everything below then. And then if you scroll down on the dashboard too, which of course my face is now kind of in front of, just like there's sex and race and age, demographics just all shown, we also have veteran status as one of the kind of demographics that is always available when you start filtering data. So this now is available and public for folks to access. We just updated it with the 2023 data. So again, that kind of like ties into what we were doing. Now, how can we make that data more accessible? Like, how can we build on these veteran suicide prevention efforts? And then finally, Hill Day. I had never gone to Hill Day. Scott, in his presentation last month, talks about how he's gone several times. So I went this year with Dr. Kelly Snooks and Dr. Connie Konstelak, and we were there. My primary job, I had all the data, was to share as much information in as little amount of time in a way that's not overwhelming. So I was like, well, how can I distill the information that I need to relay in a way that is also like easily accessible for them? So I'm I made a little note card that they could put like in a suit pocket or in a back pocket, and they could easily kind of hand out if they needed to. Just like a quick little guide as to what's going on when it comes to violent death in Wisconsin. And I decided to pick two populations that I thought kind of we could all agree are really important to focus on. And the first one was veterans, because again, I had all of this fresh, like it was fresh in my mind, information about veteran and suicide. So here is the first side of the postcard. So this is one side. It's actually smaller than what it looks like, but again, it's just like a quick snapshot. It looks probably very familiar because it was pulled directly from that fact sheet. But it's a quick little snapshot of veteran suicide in Wisconsin. And again, it's showing them a little information, but also showcasing how NVDRS is unique. So you have the demographics, but then it also shows you those life experiences, which you wouldn't be able to showcase from other data. So it's kind of twofold, like, hey, look, NVDRS, really critical to understanding veteran suicide. Look at the information that it gives us. And then the other side, I chose to highlight some statistics on child violent deaths. So you can kind of see the trends over time and how it's increased considerably since 2018. And again, I was able to also provide a little bit of circumstantial information that's unique regarding intimate partner problems and children who die by suicide, which is unique to VDRS. So again, this is just like no cards. I left a stack with everybody that I talked with to be like, here's a snapshot of a couple of things going on with violent death in Wisconsin. And it's readily accessible, and you can just pull it out of your pocket and hand it out. And now I have this template available for any time that I want to make a little note card like this. And so moving on to kind of the what's next in the dissemination work that we're doing. Before I do that, I'll just say the veteran suicide prevention work is still ongoing. I'm part of the Veteran Suicide Mortality Review team and providing data for that project. We have the dashboard, the Wisconsin Violent Death Reporting System dashboard, up and running, and we'll update it every year with new data, including related to veteran status. And then I still have that note card available, like I mentioned before, the template to use it whenever I have a similar situation where that would be appropriate. And I still need to update it with 2023 data now that we have that data available. So all of that is still ongoing and still happening. But I wanted to also present this example. It's still in suicide prevention, but just generally suicide prevention, not veteran specific. And it's just such a different way in which we are using the data. So for example, this is more research focused and more of a research study. But as you know, Jean is one of our abstractors, and she was the one who was here when I first started. And she's part-time, former law enforcement. And she's also, in the other part of her life, she's a suicide prevention advocate, and she's very well known in Wisconsin for the work she does in suicide prevention. So she, in that work that she does, she talks to a lot of people that are doing suicide prevention. So she hears things like what data they need, where are the gaps, populations they're having a hard time reaching. But then also she has this unique perspective because she is in the data. So she kind of sees what's available, hears what people are talking about, kind of back and forth. So she's got this very unique perspective. And so one of the things she said was, we have that criminal legal checkbox in VDRS, and it says, if someone died of suicide and had a criminal legal issue, but what exactly is that? That doesn't really tell us enough information to make any sort of like recommendations for prevention. So we worked together to craft her research questions, and the things that she was most interested in were when and what is the nature of the criminal involvement? So were police, did they arrive at someone's house and they wanted to arrest them for something and they died by suicide in the house, knowing the police were there? Were they out on bail? Was it something actually that there was a crime that occurred but hadn't yet been reported to the police. So this kind of when and what the nature of it was important. And then what type of crimes were we dealing with here? So if someone was being arrested for child pornography, or someone was out on bail for a DUI, was it domestic violence related and then death by cop, suicide by cop? So knowing those two things, we're going to help inform a lot of the prevention and intervention possibilities. So, Jean is very well versed in, data entry and data collection, but I then taught her kind of data analysis methodology. And we were focusing on qualitative data. So we're going through each of the narratives for each case, and we're coding then the when and the what type of crime. And we actually wrote up an abstract for the Safe States Conference in September, and we will be presenting on the process of us doing this as well as some preliminary results. So it's really been led by Jean's interest and what she knows folks in the world of suicide prevention want more information on. And we're really hoping that our results from this study will help inform those prevention efforts. And that's all I've got. Thank you for having me and letting me discuss these different dissemination projects that we've had around both veteran suicide prevention and now looking at suicide, the intersection between suicide and crime. I look forward to our discussion at the end of the month for anyone who's interested in attending. And here's my email address if anybody has any follow-up questions, who wants to reach out about anything regarding my presentation or anything regarding the Wisconsin Violent Death Reporting System. Thank you again.